Hey, it's Dr. Shirley. How are you today? It's nice to see you. Gosh, we're having a nice rain up here in upstate New York. It's making it kind of, kind of cool and, feels good inside. Good day to get some work done. I was just doing some studying. I'm taking a brain certification course with Dr. Amen. And, really I'm learning a lot of new things. And one of the things I came across, I just wanted to share with you right away. So I put down my studies to pick up the phone because I was really, very involved in figuring all this out about what medications do to our body. This isn't about you getting rid of any medications. It's just about you knowing, what can you learn by, finding out what vitamins and minerals are being depleted from your body from all these particular medications. So I'll go through, I think there's probably about 7 or 8 there. And so, hi, how are you, Robert? John, nice to see you. Hello, Cousin Herb, nice to see you too. So first of all, if you need any more information about me, my business is at drshirleysays.com. I'm going to be starting hair, skin, and nail analysis, even urine, sent through the mail, and I can tell you what vitamins and minerals are depleted. That's coming another couple weeks, so I'll let you know about that, but that's one way to know what your body may be lacking, and then we can put together a program to get you kind of up to snuff so you're feeling good, all right? So let's start right at the beginning. Antacids. Antacids seem kind of innocuous, like, oh, okay, it's just an antacid. I've got some gas, I've got some digestion, I'm going to pop a couple antacids, but antacids actually destroy what's called your hydrochloric acid, okay? And hydrochloric acid is what's important to break down our foods, break down our enzymes, even break down, parasites. I see so many people with parasites, and it's a hydrochloric acid that can actually eat through a brick that we need. We need this. So antacids destroy that. The other thing that antacids do is they deplete your calcium. Now, if any of you have listened to me for a while, you understand calcium are not just great for your bones, but good for your brain. Really helpful with your bladder if you have a weakened bladder. Wonderful for your skin, for your teeth. All of those things. Calcium is one of the most important, if not the most important mineral to keep our structural system strong. We do lose a lot of phosphorus with antacids, and you may not know a lot about phosphorus, but know this. 18% of your brain is phosphorus, okay? This is a mineral that actually composes about 1% of your body, so compared to all the other ones, it's really, pretty hefty. And our phosphorus is pretty necessary for our brain health, and phosphorus is also necessary so your calcium and magnesium can actually absorb into your body. So sometimes you'll end up with a calcium deposit, say a kidney stone, heel spurs. These are all too much calcium in your body. So if the calcium cannot absorb, then it creates these deposit, I don't know if I mentioned kidney stones, but those can be pretty crazy, especially calcifying and kind of cutting, the ureters that, kind of come through from the blood, to the bladder. One of the other things that it depletes is going to be your potassium, and potassium is super, super important mineral. Every single cell has an equal balance of potassium and sodium. Potassium and sodium help to balance your heart. They are considered your electrolytes, and they make a big difference in blood pressure. So again, every single cell has an equal balance of this, and so if you've got a situation where you're depleting your potassium, you're going to have an imbalance, perhaps holding water, but again, putting your body into a cellular disadvantage, I guess is probably the best way, to put that. I also wonder, why do they put colors in these things? I love that, like all these kid stuff is colored. So I see these antacids at, I don't know, Tums or even the off-brands. They're making them blue. They're making them, yellow and pink. I mean, does that make it more attractive? Because most dyes, or all dyes actually, have causative factors, for cancer. So if you're going to take an antacid, let's just pick a white one. But better yet, let's look at some natural enzymes. If you're over the age of 40, you probably don't have enough enzymes in your system, and enzymes help to break down your food. So if your food isn't digesting correctly, then you're going to have gas, bloating, indigestion, and maybe other causes as well too, but that's just one of them. So different enzymes you can look into, and I'd be happy to help you. If you have any personal questions, just send me a private message and I'll be able to give you some recommendations. The other thing I want to talk about is if you're taking any hormone therapy at all, not natural, but hormone therapy helps to deplete our iron. Also our magnesium. Magnesium is one of the most important minerals in the body. It controls over 5,000 enzymatic functions in the body. Wonderful for our blood pressure, wonderful for muscles that may not be contracting, any eye twitches, bowels that are kind of sluggish, stress, anxiety, focus, memory. All of these things, are so important with magnesium. One of the best things you can get into your body. I take a magnesium complex, and I would not be without it because it's just something that balances my body from the inside out. The other thing, if you're taking any hormonal therapy at all, is you're going to lose your vitamin C, which is your antioxidants, and your zinc. Zinc is very helpful for our immune system, and for men, super important for the prostate. And vitamin K. And vitamin K helps our blood to clot. All right. Next thing is your diabetic meds. And, again, I'm not a medical doctor. I'm not telling anyone, to go off any meds, at all. My point is if you're taking these meds, if you have to take these meds, you really want to supplement as well, too, because you are below the bar when it comes to you having enough nutrients in your body. Every single day, more and more is leaching out of your body. And you start to see some of the side effects of this may be, like with diabetic meds, you could be low on your CoQ10, and CoQ10 is essential for heart health. Okay, essential. In fact, there's been studies shown that that CoQ10 can even prevent a second heart attack if someone has had one. CoQ10 is the enzymatic factor that helps to keep our heart strong, to keep the beat, to keep you from having any kind of. It's not necessarily to keep from any heart failure. That's probably too strong, but it's a very important enzyme. And anytime you're taking something that's depleting that, and the cholesterol meds do that as well too, you've really got a problem. The other thing with diabetic meds is you're going to deplete is your B12, and B12 is super important both for your digestion system and to get food assimilated throughout your body. All right, the next thing I want to talk about is blood pressure medications. I see a lot of people that take blood pressure medications, and again, I totally get that. I'm not here to judge that. I'm just here to tell you if you are taking these meds, and blood pressure is obviously important, and blood pressure is a component of magnesium, potassium, and sodium. Okay, we can also lower our blood pressure with meditation, with the stress relaxation, yoga. I mean, there's a lot of natural ways to work on that, weight, all of those things, okay? But if you are taking blood pressure medication, you need to know you're reducing your vitamin B6, okay? B6 is essential for your nervous system. It also has a lot to do with people that may experience some carpal tunnel type of things. B6 is associated with that. Most importantly, it's going to deplete your potassium, okay? And potassium is super important to regulate your blood pressure. So see what happens? You got a high blood pressure. You're taking a blood pressure med. It lowers your potassium, which has the potential to then raise your blood pressure. So potassium is found in a lot of foods, and I'm sure you can, you might say, oh, bananas, and that's just good marketing. Yes, there's good potassium in bananas, but the best are actually avocados and sweet potatoes. All of your fruits, all of your vegetables, all your green leafies, anything, like that are going to be really great sources of potassium. From an herbal standpoint, we look at things like alfalfa and spirulina and bee pollen, and these are herbal sources of potassium. So real important to keep that balance within your body. When we have a potassium drop, we also may find that our body is tired in the afternoon. If you get to be around 3-4 o'clock, even 2 to 3, you're like, you're just feeling like logy, especially if you're in an office doing something maybe you don't want to do. Our bodies naturally want to slow down. Then we have a natural potassium dip at that time. So taking in some herbals, some good food, and also water. If you're tired, water is sometimes the culprit, and it's really not any more than that. Also, with the blood pressure meds, you're going to have a reduction in zinc, and again, zinc is super important for your immune system. It has a lot to do as people get older. Sometimes they don't have as much of a sense of taste or smell, and that has to do with zinc. And also, again, the male prostate, okay? Prostate cancer with men is a very big, I don't know what the numbers are, I didn't look it up today, but it's high, and it's not necessarily, they don't even say that it's, quote, dangerous anymore, but you want to keep that prostate as good as you can. I mean, I give Marcus-Saw palmetto, which is very high in zinc, and it's shown to be just as effective in studies as Proscar or any of the other meds, but do your own research on that. And again, fill in the blanks if you are taking any meds along those lines. The other thing that's going to be lowered on that is your CoQ10, and we just spoke about how important that is for your heart. And the magnesium, again, number one mineral, I should say. Even when I travel, I go away a lot, and Mark will always laugh because once I went to India for, I think, about 5 weeks, and clearly half of my bag was my vitamins and my minerals. But I guess it's like a medicine cabinet too, and you want to feel as good as you can, while you're away as well as while you're home. So how about anti-inflammatories? Okay, it's real important to get inflammation down, but do we want to do that, from a medicine standpoint? So from the anti-inflammatory standpoint, you're going to be reducing your vitamin B6. Okay, vitamin B6, again, important for your nervous system. All of your nervous system runs on Bs, and your Bs are water soluble. Okay, so water soluble means that the vitamin goes in, your body uses what it wants, and the rest gets excreted. Fat soluble means that the vitamin comes in, the body uses what it needs, and then the rest gets stored either in the liver or in the body fat. Okay, so hi Colleen, hi Susan, hey Marge, nice to see you. So with anti-inflammatories, you're also going to be reducing your vitamin K, very important for a clotting factor. You're going to be reducing your iron, and iron is very important. It creates hemoglobin, and hemoglobin is the oxygen carrying component that brings oxygen to your brain. Iron is also super important for our moods, And a lot of times, like a depression, it's not related to anything, situational, can be related to a low iron level. You're going to be reducing your vitamin C, super important as an antioxidant to take care of all of the, I guess the people, the bad cells that are going after the cells in your body. Vitamin D, we know a lot has to do not only with our mood, but it has a lot to do with our bones. We get our best vitamin D from the sun, okay? You heard it here. I'm a big sun worshiper. No, I don't go out with baby oil and foil around my face, but vitamin D is one of the best things that you can get in naturally. Okay, you could go out there even just 20 minutes a day. Doesn't mean it's at high noon and all that kind of thing, but vitamin D is also best absorbed through our eyes. And so a lot of times people have been really conditioned to have all these UV protection type of sunglasses on. You're not getting your vitamin D in. And then also too, if you're wearing longer sleeves, or here in the Northeast we don't get as much sunshine, but just getting outside for 15 to 20 minutes a day is going to give you all the vitamin D you need, and it's going to absorb into your system. Okay, let's talk about cholesterol meds. Cholesterol meds are really, really popular. I'm personally not a fan, but again, not a medical doctor, not telling anyone to not go on them, but cholesterol is important to your body, okay? Cholesterol actually creates our hormones in our body. Cholesterol helps to heal our body. And so the way that the problem happens is, let's take your heart, and you've got these veins and arteries coming off your heart, and let's say there's inflammation, and when there's inflammation, that these veins and arteries actually kind of start to crack like an old hose is the analogy that I use. So with these cracks, the cholesterol goes by and the blood is like, oh wait, there's a problem. So like I always use the analogy like with a mason. Okay, let's put on some cholesterol and help to heal this. All right, then all of a sudden there's still inflammation, body goes by again, more cholesterol, then all of a sudden you got this vein, you've got all this occlusion going on in here, and the blood can't get through, and then you've got yourself a heart attack or a stroke. All right, so it's the buildup that becomes the issue. When we bring our cholesterol down too low artificially, then we've got problems as well too. So you want to be able to control this naturally. Yes, there's vitamins. Yes, there's herbs that can do that. And again, happy to talk to anyone. You can, send me a message. I'd be happy to share this with you. But the cholesterol meds, most importantly, are going to lower your CoQ10. CoQ10 is essential for heart health. Okay, there's been a lot of heart attack associated to cholesterol meds. Okay, you can look that up. You can Google that. Find 10 different studies about it. It's not just me, saying this. And so if you are taking cholesterol meds, it's imperative that you take a good CoQ10, all right? You don't want to end up having an unnecessarily heart attack or an unnecessary stroke, obviously. And the whole idea you're doing this is to help your body, but again, I encourage you to research about that and, is it really helping you as much as you need it to? The other thing that's depleted is your essential omega fatty acids, and you are maybe familiar with these. These are, from your fish, these are from fish oils. They are so important, especially for the, for the brain. And so if you're going to be depleting these, and these are going to be important also for the cell permeability, allowing nutrients to come in and out, for our vascular system, again, within our brain, and our nervous system as well too. So our nerves are in a bundle. You may have heard the term bundle of nerves, and it's covered by what's called a myelin sheath. And the myelin sheath is what protects the nerves. Now, when that opens up, that myelin sheath, then you've got some neurological problems, possibly like a Parkinson's, possibly like an MS. Okay, not a good thing. So the essential fatty acids are what helps to soothe, okay, and to repair these nerve bundles. So this is another very, very important thing. I believe everybody should be taking essential fatty acids, absolutely everyone. The other thing that's going to get reduced in there is your carnitine, okay? And carnitine is super important to help your body burn fat. And the other thing is that any of these meds are going to put a stress on your liver, no matter how you slice it. Our liver is a very resilient organ. It's on the right side of the body. It filtrates about 5,000 different things out of your body. It needs to be cleansed twice a year, okay? You've got to cleanse your body if you want to be healthy. Health takes time, health takes energy, health takes discipline. Is it worth it? Absolutely, but it takes some time. Sometimes people say it's a part-time job. So if you're taking a cholesterol med and you're getting rid of your carnitine, and carnitine is the amino acid that starts burning your fat, well, you've got a problem. You may be ending up gaining some weight somewhere along the line. And again, you're putting a stress on your liver, and your liver is the organ that also burns fat and helps your body to balance itself out. So if your body's too busy worrying on toxins, it's not going to be burning, your liver's not going to be burning the fat that it actually needs to watch as well too. So, hey Kathy, nice to see you. Hey Jean, how are you? Nice to see you too. Now, how about antibiotics? Sometimes we need antibiotics. You do not want to screw around with an infection. I remember many years ago, I had a client, and she calls and says her son's at camp. He runs his hand through a barbed wire. it's cut wide open. It's pus and it's all this kind of stuff. And he's at camp for 5 or 6 days. No one does anything. She comes home. She says, well, what herb can I take? I'm like, the kid needs an antibiotic. She goes, well, I want to do this naturally. I'm like, you can think you want to do that, but the kid needs an antibiotic. You don't want to risk having a systemic type of infection. Now, you can catch things early, absolutely. But if you're taking antibiotics, you are losing your B vitamins, all right? B vitamins, again, essential for the nervous system, essential for the brain, essential for calming, also very important, for your digestive system too. You're going to lose your vitamin K, which is your clotting factor, helping your blood to clot when it needs to clot, like if there's an injury. And the other thing that it does, which I see so many problems from, it destroys your gut bacteria. Gut health is so important. It's very interesting. I've been in practice for a lot of years, and last time I was in practice was maybe 5-6 years ago. I would see maybe 1 out of, 30, 40, maybe even 50 people would have parasites. And now I'm seeing like 5 out of 10. It's crazy. I literally can't put my finger on it. I've seen, 60 people in the last, couple months, and I cannot tell you the amount of people that have parasites in their body. And I believe so much of it has to do with the poor gut health that is within our system. So if you are taking antibiotics, when you're done, do some probiotics, okay? Get good gut bacteria in there. Get your bifidobacillus. Yes, take your yogurt, all that kind of stuff, but it's real important to get that in to repair that gut. Maybe some collagen. That's another thing that's going to help to repair the gut, but you must repair that, because if you leave that wide open, it's just like leaving your doors wide open when you go on vacation. Anything can come in and set up house, and all of a sudden you got another problem. Like I said, candida, yeast, or parasite, something along those lines. And then the last one I'll talk about today is birth control. Birth control, again, a lot of people like to take it. I took it for a short time when I was, very young, but it does have consequences in your body. It does deplete your B vitamins and your magnesium. We talked about both of those. Depletes iron and your folic and your selenium. And selenium helps vitamin E to absorb. It's also antioxidant, helping your body to have less inflammation. And it also reduces your tyrosine, and tyrosine helps us to concentrate, helps us for mind and for focus and for concentration. So that's pretty much what I have today. Thank you all for watching. If you have any comments, if you could leave some comments, hey, like the class, hey, this is good, I really appreciate it. It just passes it on, that Facebook, logarithm thing. And again, I'm going to be starting my hair, skin, nail, and urine analysis in about 2 weeks. So you're going to be able to send me some hair, a little bit of spittle, we're going to a couple pieces of nails, and then my system is able to test this, and I can give you a full report and let you know exactly what nutrients you may need, exactly whatever it is that is needed for you to make you healthy. So I'm always here to help. My website is drshirleysays.com, and again, please leave me a message or a thumbs up or something so we can get this information out to the world. Thanks again. Talk to you soon. Bye.